You should listen to the legal statement also on this channel, but these who I have recorded are government subcontractors and contractors, are agents of the state government acting under color of law in the public fora, and they do not have an expectation of privacy, and it's compliant with Maryland's audio recording laws.
Fully, because I actually did not want to see a neurologist. I was being treated by my primary care for the heart problem, and since I had some questions for him, the problem that came up is he was treating with the usual antihypertensive medications, and it looks like there's a reflex coming from the increased pressure in the head, because obviously because when I took because what the doctor discussed with me is that when you don't have the regular kind of hypertension, which is, I guess, the essential hypertension caused by a bad diet and so forth, so you have a increased blood pressure as a reflex to increased intracranial pressure. And as soon as we start treating for the increased blood pressure, I guess, to also treat for the heart problem, it does a really great job of helping the heart problem and of getting the pressure down really fast. But that's the problem. When the pressure went down really fast, the numbness and the tingling in the head went up so much that I can't even drive at night. And then when I backed off the medication, so we are trying to just understand that one point, that reflex with the intracranial
numbness and well, first of all, the blood pressure is not really going to influence the intracranial pressure.
Okay, so the
blood pressure is completely separate from the intracranial pressure, unless your blood pressure gets to be like 250 over 150, where you have blood leaking out of the blood vessels.
Okay,
but your blood pressure going up to 170 over 90 or 170 over 100 will have no influence at all on your intracranial pressure.
Okay, but
that's
actually I was trying to work the other way around.
No,
with the intracranial pressure being high, would that trigger off the blood pressure going up?
Why would you? No, you have no reason to have increased intracranial pressure.
Right, and that's the point I went to back then, because when the water was injected upstream, there's no way to get around it, because it shows up on the electronic evidence that I was unconscious for 45 minutes, and that has nothing to do with the MRI.
You know what? Yeah. I don't think I'm going to be able to help you.
Okay, I mean that's what I told. Yeah. That's what I told the primary. I know, because I was trying to get treated by the primary care, and actually it's really his job to treat, and I'm not sure why he sent me here. Yeah. What I actually told him is,
So stop tape with Dr. Wicker's lies again. If you notice, the problem I told Dr. Wicker about was that when you have increased intracranial pressure, as a reflex, the blood pressure in the body goes high. Well, not high, it goes higher than it was. And then you're not supposed to lower that blood pressure, and if you lower it, then you feel some symptoms in your head. Okay, and if you notice what Dr. Wicker did is, and we already, this is well known in the medical literature, but also if you listen to when I was with my primary care, Dr. McCarthy, he easily agreed to it that there is this reflex which happens. But if you listen to Dr. Wicker, what he does is he intentionally says it the other way around. He brings up the point of increased blood pressure causing increased intracranial pressure. I never said, and he knew very well when I was talking about the reflex and so forth, I wasn't saying that increased blood pressure causes increased intracranial pressure. I said the other way around, which is increased intracranial pressure causing increased blood pressure. But he knows exactly what's going on, so he said it the other way, which is to say that the usual blood pressure problem. And so in that, I never even looked into it, and so what he said is probably true. What he says is, and I've never heard of having increased blood pressure causing increased intracranial pressure. So he's right about that. Increased blood pressure does not cause increased intracranial pressure. But that's not what I said, and that's not that's not what I said over and over again, and that's not what I discussed with my primary care, and he knew it very well, and he intentionally, if you go back and listen to him again, he's intentionally saying it in reverse. So he says that, well, if you have even like really high blood pressure, then, if you have like fluid leaking out, boy, you'll be in a lot of trouble at that point. And so I guess if you have really high blood pressure and you have fluid leaking out, and that could cause increased intracranial pressure. But, I never made that point. That was not what I said. And he knew it very well. And what he knew it very well that what I said is the increased intracranial pressure resulted in an increased blood pressure, and so he intentionally switched the order so that he can dismiss that argument. But I persisted and I said, no, it's the other way, that I had the increased intracranial pressure first. And then he tells me I have no reason for having increased intracranial pressure. Well, I did not have any reason until that guy at the MRI place did that injection and caused a brain injury to me. And not only did he cause the brain injury, because when the landslide was coming down, it caused the problem with the fluid returning to the heart. And when you have the problem between, and anyone can look this up, if you have, now I don't think I have any kind of, you have the large vein which is called the superior vena cava, and that's the large vein that comes just above the heart coming down from the brain. And obviously that would not be completely blocked, or else I wouldn't be alive. But there was problems there. That's why I have the collateral circulation, which is seen on top of my chest. And when you have that problem also causes increased intracranial pressure. So you don't have to have a brain injury. You can even have the problem with the blood returning from the head to the heart, and that can cause the pressure in the head. And so he's telling me I have no reason for having increased intracranial pressure. And of course, that's because he completely chooses to ignore that event at the MRI facility. And also, I actually proved the reflex, because I told him my blood pressure was 124/74, and after that injection my blood pressure was 165/85. So obviously that reflex took place. So there's no denying that that reflex took place. And so he's telling me I have no reason, but actually I don't have any reason to have hypertension, and that's also a point, because when I had a CT done and it showed my arteries in my heart. They were very clear. Actually, it showed that I had less calcification than 100% of the men in my age group. So basically, when you look at the calcification score from my heart, which is the best way to kind of see whether a person has a bad diet and poor exercise, so forth, and I basically had the best score. So, I would really have no reason to have any of the usual heart conditions or anything related to that, and I don't smoke, so I would have no reason to have high blood pressure. So actually what is a fact is I would have absolutely no reason to have high blood pressure, and I would have all the reason to have increased intracranial pressure. And it was also proven I did not have high blood pressure going in, and going in meaning it was measured like a few weeks before that at the doctor's office, and I didn't have it coming out. Coming out meaning it was measured like 40 days later with the second visit to the doctor's office. So, and in the past also, I never had any kind of blood pressure problem. So he's completely trying to reverse it. He's trying to say that I have a high blood pressure problem, and my high blood pressure problem is not high enough to cause an intracranial pressure problem. But in fact, what I was saying is I don't have a high blood pressure problem, and I had all the reason to have increased intracranial pressure coming from that injury, and that it's a proven reflex, and it actually shows up in my records where my blood pressure went up. So, and I had swellings under my eyes as soon as that MRI thing was done. And also, I had swellings on top of my forehead, which kind of looked like horns, and they changed and they became bigger and they became wider. So, this Dr. Wicker can see me, and now I do have all those pictures, all those images. I actually have it on YouTube, but I haven't made it public. So Dr. Wicker can easily see all the swellings on my head, and it's obvious intracranial increase in pressure, and he claims that there is he doesn't say that there is no increased intracranial pressure. He says that there is no reason for it to be there. That's of course after he intentionally wipes clear all the history. But obviously my forehead has all these swellings and he sees them.